Hello and welcome to this UCN Vishesh program. I am calling it Vishesh because it is a special program. Special because there are two eminent doctors on the panel today, and we will be talking about a very important topic called as heart and its related ailments, etc. I take this opportunity to request Dr. Patil, who is here, and he is the director of Shree Swami Samarth Hospital and Multi-Speciality Hospital. He will be coming talking about Dr. S. Ramaswamy, who is come from Chennai here, and he will be talking about him. So I request you, sir, to please introduce Dr. S. Ramaswamy.
Hello UCN viewers. First of all, wish you a happy and prosperous new year. Today I am very lucky and honored to have two mentors of my life. Mentors is a person who sees what others cannot see, and they navigate the life of their disciple in such a way that he blossoms like anything. So the first mentor of my life is Mr. Sharma. He taught me in 1985. I used to bunk other classes but attend his classes. So that makes me lucky today to have him as a person who is going to take interview of mine. The second mentor of my life is Dr. Ramaswamy. He came in my life in 2004. And he taught me non-surgical treatment EECP. From there onward, he navigated my life to success and blossomed my life like anything. Today, whatever I am, the hand of Dr. Ramaswamy is very much, because he supported me on every steps and guided me. Dr. Ramaswamy sir is a kind-hearted and a noble person. He is the director and CEO of Heal Your Heart Center. Heal Your Heart Center is situated in Chennai and it has branches all over India.
Even on the globe, itself?
Yeah. No.
Globally?
All over India.
Okay. Thank you for those compliments, sir, that you paid to me at the start of the program. If I could start with you, sir.
Yes.
What brings you here to Nagpur?
Today I had a good opportunity. In fact, I am very happy and pleased. I was invited by Dr. Pradip Patil that is starting his EECP center. In fact, he started the center in 2004, if I am right. And from that, stage by stage, he picked up from one mission, second mission and third mission. And today I am very happy with him to inaugurate his fourth mission in the same place.
So nice.
That's a very wonderful news, because not many people in India could be able to do it. The maximum seen is 2 to 3 missions.
But he has 4.
He has 4, I think.
It must be a record also.
Yes, I think in this area, I think it would be the first largest EECP center in this Vidarbha, or I would say even in...
So before we start, I would like to request you to say something about your educational journey, which I heard it was full of hurdles.
Yeah, actually I started my medical education in Karnataka, Davangere. And then after finishing my Davangere, I came back to Chennai and I did my housemanship in Stanley Medical College. And after that, I moved on to Pondicherry, and there I did my senior residentship. And after that, I took my exam, USMLE, and I went to US. There in US, I started my residency program. That's what I went for. But actually, I took a fellowship in clinical cardiology in Portchester University. And there my interest took a turn. I was looking at various treatment for heart disease. In that, I got quite impressed by a new emerging technology that time. It's called enhanced external counterpulsation.
When was that, sir?
This was in 1999 and 2000.
Okay.
So, in fact, I was involved in this project that the first commercial EECP system in the world was initiated in Portchester University that time. So, I was a fellow there and I started working on that under my chief mentor, who is called Dr. Tattaglia. So, I was so lucky that this new concept, when was been originating in US, I am one of the pioneers to even start up the project in the US itself.
So nice. Dr. Patil, what would you like to say something about this Shree Swami Samarth Heart Care and Multi-Speciality Hospital, Trimurti, Nagar?
Shree Swami Samarth Hospital ये जो है ये नॉन सर्जिकल ट्रीटमेंट हार्ट के ब्लॉकेजेस का करता है 70 to 100% हार्ट ब्लॉकेजेस का, और जो कमजोर हृदय हार्ट फेलियर पेशेंट्स का उनका ये ट्रीटमेंट बिना ऑपरेशन के करता है। आज 2004 से हम लोग ट्रीटमेंट कर रहे हैं, करीब 4000 के ऊपर पेशेंट हो चुके हैं। राइट फ्रॉम स्टार्टिंग फ्रॉम फर्स्ट मशीन, यानी एक मशीन आई, फिर 2 मशीन आई, फिर 3 मशीन आई, अभी 4थी मशीन हम लोग लॉन्च कर रहे हैं. सो नाउ इट हैज़ बिकम द बिगेस्ट सेंटर, जहाँ पे पेशेंट अपने तकलीफें लेके आते हैं और हार्ट की तकलीफ लेके आते हैं, तो उनको हम लोग बिना ऑपरेशन के ट्रीट करते हैं, तो बाद में वो खुशी खुशी अपने घर जाते हैं. तो इसमें हमें संतोष बहुत होता है.
जी सर, आपने एक टर्म यूज़ किया हार्ट फेलियर. तो बिफोर यू embark upon these things, these points, EECP etc., मैं चाहता हूँ कि either of you could just say what are these terms: heart failure, heart attack, cardiac arrest, myocardial infarction, then angina. These terms quite often are confusing.
So it's interesting. I mean, you put all that concept in a single question, and see, heart is an organ which start pumping from the day you are born until you die. So it keeps pumping every day. So when it start pumping, it's required blood supply for itself. Right. That blood supply is provided by what we call as coronary arteries. So these coronary arteries continuously nourish the heart muscle, which is called myocardium, with oxygen and with nutrition. So sometimes when these coronary arteries are obstructed or blocked, then the nutrition is not able to reach the heart muscle. So when the nutrition is not able to reach the heart muscle become ischemic, or it become lack of blood supply. Now this is where the patient get the chest pain.
Right.
So what they say is, doctor, I'm okay, but I'm going to start doing something, I get discomfort. So it shows the blood supply is not adequate enough to have a complete heart functioning.
Right.
So this is called chest pain. Now, if you ignore this and you keep going on and on, some one point of time, this obstruction become 100%. Now what will happen? The blood flow is completely stopped. Now this leads to what we call as a heart attack, which is called myocardial infarction. So the heart muscle, without getting enough blood supply, slowly and eventually it dies. So death of the heart muscle is called heart attack or myocardial infarction.
How much time do you get, sir, if you come across such a situation?
See, I mean, usually
to save a heart attack person.
Yeah, this is very important because its time is muscle. So when you have a chest discomfort which is not relieved with taking rest or taking some medicine, immediately you should go and go to a nearby hospital. At that time, if they can able to give you some drugs and dissolve the blocks, which we call as thrombolysis, or we can able to open up the vessel, then we can able to prevent a heart attack.
Okay.
So the decreased blood supply to heart attack. So this is a time period which we can able to save the muscle.
Right.
Sometimes this is called heart attack. Another form which you brought it was cardiac arrest.
Arrest, yeah.
And now you have seen in many times young individual doing exercise, suddenly they fainted, suddenly they got a cardiac arrest and died.
We had recent examples, KK, Raju Srivastava.
Yes. Yeah. Now this is a separate entity. Now so far we spoke about myocardial infarction or heart attack. Now cardiac arrest is another entity. Now as I was talking about the blood flow to the heart muscle, there is also another circuit. This is called the electrical impulse. Because as you know, everybody know heart pumps in a rhythmic fashion, lumped up, systole, diastole, systole, diastole. To the rhythmic function of the heart is directly depend upon the electrical signal. So sometimes these electrical signals are interrupted or suddenly stops. When the electrical impulse stops.
What could be the reason for interruption?
There are so many causes, but the more common causes, again I go back to the lack of blood supply. So, or it can be an inherent problem. Suddenly, it's like a circuit. You have a circuit break. You don't have many times you don't know the reason. Suddenly, the circuit stops. Similarly, the electrical impulse stops, even without the blood, even when there is a normal blood flow also.
That could be a rare case.
Yes. And when that happens, electrical impulses stop. It's called cardiac arrest because you don't have any time now. The heart stops immediately. When the heart stops, within 1 to 2 minutes, death naturally ensures. So this is called cardiac arrest. And then you spoke about heart failure. Now many times when the lack of blood flow is so severe, the heart muscle will stop functioning as it's supposed to be.
Okay.
So instead of contracting with much force, the force is lost. So it is contracting with less force.
So the efficiency is affected.
Very good. Yes. The efficacy of the heart muscle is not adequate. for your routine requirement. Your routine requirement is what? You need to go to your bathroom, take a bath or walk for 10 minutes, 15 minutes. It should not cause any trouble. But when the heart muscle is not pumping as much as supposed to be,
capacity.
and then it is called heart failure. So it is actually a misnomer. Heart failure doesn't mean your heart has failed. It only means your heart is not functioning as it is supposed to be.
But it could lead to an attack.
Yes, if you have a heart failure, it means sometimes you already had an attack. Because of that, your heart is failing.
Okay.
And people with low pumping function are at higher risk of again getting a heart attack and again getting rehospitalization because of breathing trouble. So when the function of heart comes down, there are a lot of things can happen to you, lead to your hospitalization.
Okay. Then what is refractory angina? And this is also again a term.
Yes. And refractory angina is, see, when you talk about chest pain, then there are a lot of options available to you. You have a medicines. So you give certain medication, you can improve the cardiac function and improve the symptoms. If the medication doesn't relieve, then you have other alternative high risk procedures like a bypass surgery or angioplasty, or now what we are going to talk about is EECP. These are all the options which is available when the medication fails and you go for a interventional procedure. Many times, interventional procedure is not a permanent solution. People should understand it. When they go for a bypass